Same kind of time period.
Are you gonna be able to wait very long?
No.
That all they do. What's that?
No.
That's the best they can do. Yeah, he said we'd have to move back. Either way, we cut one side or the other side out.
I assume you're gonna be out the same day?
No.
So we could move back, I guess, but.
Well, you know, it's pretty, goes into one original section.
Good morning. Can everybody on the call hear me clearly?
They always do that.
Yes, ma'am. Yes.
Wonderful. So I apologize for any audio issues. My name is Ashley Anderson, Health Education Specialist and Acting PIO. I will be moderating today's Zoom session health meeting. Just a couple of reminders. Please be mindful of your conduct in today's meeting, as we will record this meeting and it will be posted to YouTube. We welcome any comments, questions, feedback to publichealthidaho@phd3.idaho.gov at any time. And please direct any virtual session related comments, questions, or concerns to myself through private message on Zoom if you are participating in the Zoom call. And I believe with that, I can turn it to Chairman Elliott to begin today's meeting. Thank you.
I fractured what's called the syndrome motion,
Elliott,
and I
think we're ready to call it to order.
lost both of them. And you know, one of the comments is pain out of proportion to the injury. Let me tell you, I was hurt so bad.
Yeah.
And
No, I don't.
I think we're ready to get going. As we're trying to talk about with all the conversations we can share.
it called me a pussy.
Sorry.
Okay,
Yeah, I'm sorry.
if that's the case, you're gonna drive the whip then,
Yes,
okay.
I'm sorry. Thank you for letting me interrupt you.
Yeah, I know,
It was gentle.
So he gave the left hand.
Thank you.
Where's the, they throw salt water on you or something when you get the?
No.
Oh, all right. We've just barely passed the 9 o'clock hour, so I'm going to call the meeting to order. Get the thing, a little gavel. So, who do we have remotely?
I'm pretty remote.
Well, okay.
All right. So that would be Ashley Anderson. I'll be moderating today's Zoom session. I believe we have Jamie Annenson, Doug Downey, Commissioner Marvin, Olivia Howard, Sarah Andrade, Troy Cunningham, and anyone else that may be on the line that we did not call.
Carol Julius,
Okay.
can you hear me?
Yes.
Yes,
Okay,
okay. And so, we do have Commissioner Marvin, you said?
Yes, he is logged in, but I believe he's muted.
Okay, all right. And, is Vicky attending remotely today, or is she not? Okay. All right, very good. With that then, would you, please join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
Followed by
one nation, under God, indivisible, with liberty and justice for all. Thank you.
Enter your participant ID followed by pound. Otherwise, just press pound to continue. You are in the meeting now. There are 10 participants in the meeting. This meeting is being recorded. You have been put on hold by the host. You cannot listen or talk until the host releases the hold.
I wonder if
Okay.
someone from in the room is.
Anyway, I guess, roll call, we sort of had a roll call for the remote folks. Let's go around the table and. Names.
Georgia Hannigan, Fayette County.
Okay.
Troy Evans, Whiting County.
Brian Elliott, Jim County.
Sam Summers, position.
Tom Dale, Canyon County.
Okay, thank you. Have you had a chance to look at the agenda? Is there anything of informational that can be, that would like to be added or changed? Okay, hearing none, I would stand for a motion to approve the agenda.
So moved.
Okay, have a motion and a second. Do I have a second? Okay, have a motion and a second. All in favor, say aye.
Aye.
Okay, that carries. All right, we have a 15-minute, segment set aside for public comment. We will hold this down. Sometimes the public comment gets long, so we're gonna have like 3 minutes, which would give at least 5 people a chance to speak their piece, I guess. If you have anything you'd like to say, would you please come to the podium, state your name, so that those remotely and whatever can know who's talking. Anybody like to provide any comment this morning? Yes, ma'am.
Rosemary to the front counter, Rosemary to the front counter.
Your time is up.
So far, I've been hearing that the, plans for health.
Name,
Oh, I'm sorry. My name is Maggie Goff, and I live in Nampa, Idaho.
Okay.
And, so the plan that I've been understanding is we're going to hide from the virus and wait for the vaccine. At least that's my take on. And so I was just hoping that at some point we can actually start talking about health and what it means to be healthy. I've been to your website, and I see that there is a lot of stuff on your website regarding health, and nutrition and exercise, and all the stuff that it actually takes to have a healthy body, healthy mind, and all of that stuff. But I just don't hear it pushed enough, and I'm just hoping at some point we can actually start talking about health and not just trying to hide and wait for vaccine.
Thank you. Appreciate your
Yeah.
your comment and input. Anyone else? Yes, sir.
My name's John Ennis, and I'm from, Ola, Jim County, and, along today. But, I'm here just to see, I've seen a lot of things going on about, vaccine sites, some mass things that are up in some of the places. I just want to know, and I want to see that we remember that we do have rights, and that these rights won't be infringed on when it comes to a vaccine or even wearing a mask. It's our decision, it's our body, and that we need to, as individuals, fight for whatever we have to do that. I know in Jim County, a lot of the places now are, you don't have to wear a mask if you don't want to. So it's our choice, which is really nice. The vaccine thing that I've been seeing, where there's going to be different sites, shame on the government for doing this. Shame on the government for threatening you guys when you guys are trying to do what's right. We know that you guys, the interest that they're having for us, and yourselves, and your family. And the reason why I'm here, I'm old now. The reason why I'm here is I have grandchildren, 10 of them, a great-grandchild. I have children. I want to make sure that their safety's there. I have, some of them are in the medical field, nurses, individuals like that. I just want to make sure that we aren't going to be threatened or mandated on things that we won't comply, because we won't comply. We're still United States citizens. I'm a Native American, and I will fight for my rights all the way to my last breath. So, God bless you guys for what you are doing, because I know that you guys have a lot on your plate, and I understand that. But you got to realize, we the people here want the best for everybody, just like you, putting a vaccine and putting masks on. God bless you guys.
Thank you. Thank you. Appreciate your comments. Yes, ma'am. She beat you by a half second.
I'm here from Nampa. I come from a communist country in Eastern Europe. I was still a child when I came, but my parents had to suffer greatly for their religious and their political views. I just want to say that I'm very afraid for this country, and I always thought Idaho was still a beacon of freedom and the state, and I would like to say, just like he said, mandating a mask, which we didn't do, would have been terrible. I hope it's not going to get to that. We the people don't want that. I mean, people have the freedom to wear it. I respect that. But the vaccine is a much greater, a much riskier endeavor, and I hope that you will stand with the people and consider our freedom of health and not mandate that on anybody, you know, whether they're old or young or sick. Or I think anybody who's able to make a decision, they should be allowed to make that decision for their own body, whether they accept the vaccine, especially hearing all kinds of things about this being a trackable tracing vaccine and all kinds of things, a very dangerous vaccine. So I would like to make sure that you guys understand that I think most of the people would not want to be forced into a vaccine. Because where I come from, even though I was 13 when I came, I do remember the government mandating every area of our life. And I think it's at the local level that we can still fight back. And I know you might have to be on the front line to risk your job work, but I think I would encourage you to stand for the truth, because I see this country heading south very fast, becoming a communist nation. And it happens with infringement on freedom, like health freedom, freedom to speak, and a lot of things. So I don't want to take much time. I know there's other people that will want to voice it. So I really appreciate it. Please stand for the people. Thank you.
Thank you. Yes, ma'am.
Hi, my name is Susan Lang. I actually live in Boise. My son goes to school here in Nampa. We do business in Nampa and Caldwell, and we're considering moving out this direction. We refuse to wear masks in my family, and we're also not going to get a vaccine, regardless of what happens. So I appreciate that you guys have a tremendous amount of pressure on you, probably coming from at least two different directions. And I know how hard it is to stand up against that pressure. But I would ask you to think about enforcement. So when the people at our local level of government don't stand up against the pressure, then the buck gets passed to the local businesses who become enforcers. Now you have a 20-year-old kid working at Albertsons telling somebody like me that I have to wear a mask, you know? It makes them enforcement. It makes them an arm of the government, actually, which isn't right. And it puts me in an adversarial relationship with them just so I can buy food for my family. That isn't right. Well, with masks, it's fairly obvious because you can look at a person and see if they're wearing a mask, you know? And I wonder, since this whole COVID thing, flatten the curve, was only supposed to last a couple of weeks, now we're 6 months into it, I wonder when the mask thing ends and it now becomes, oh, now you have to have a vaccination to go into Albertsons, how will that be monitored and enforced? Because you cannot see a vaccination like you can see a mask. So then are we passing the buck to the 20-year-old kid who works at the door at the cash register at Albertsons to check my vaccination card? I mean, really, what does enforcement look like? And how does that come down for somebody like me who's a mother and a teenager and a wife? I'm just trying to get my food because I won't comply with vaccine no matter what. My child understands the issues, and he will not willingly ever get a vaccine either, nor will my husband. So does that mean we don't buy food? So I'm asking you to think about that at this level where you are right now, because ultimately what it comes down to is enforcement. And when enforcement becomes really unreasonable, I think that that says that there was something wrong with the mandate. So please think ahead to what enforcement is going to look like. I thank you for your time.
Thank you. Is there anyone else? Yes, ma'am.
I'm Lori Marr. I live in Nampa, and I just wanted to tell you guys that we will have your back as you have ours. There's, for every one person here, you know there's 1,000 more. We need you, and we will back you up. Thank you.
Thank you. Anyone else?
I'm Clarice Kerrigan, I'm from Caldwell. I'm addressing you in anticipation that at some point you are going to be talking about possibly mandating vaccines. So that's where I'm coming from. Thank you for not mandating masks. Please do not mandate the COVID-19 vaccine. Mandate the vaccine would be a gross violation of our right of personal autonomy, a violation of our right to protect our bodies from assault. No one should have a foreign body function into their person against their will. Under any other circumstances, it would be seen as an act of violence. Why not now? I suspect it's because the virus has become politicized. Please stand against federal and state pressure. Be a hero to your citizens of Fayette, Hawaii, Washington Canyon, and Gem County, and protect the people against this agenda. The yearly flu vaccine has not been mandated. Don't make the COVID vaccine mandatory either. No one knows the damaging effects, the far-reaching damaging effects of this vaccine. It may have far-reaching damaging effects in years to come. It takes years for all the side effects of a medication to be known. That's still word still. The publication put out by a consumer watchdog group founded by Ralph Nader recommends that no one take a medication that has not been on the market for less than 10 years. It takes that long for all the side effects to be known. The publication says this is especially true for older citizens, as they are generally more sensitive to medication. To allay the public fears, Sarah Lee of Idaho Department of Health and Welfare, manager of immunization program, says we can trust the drug companies that are producing the new vaccine, but they would not do anything to hurt their reputation. Therefore, she says we can believe that the vaccine is safe. History has proven that we cannot trust Big Pharma with our health. The industry does many things for the bottom line. That is, Big Pharma cannot be trusted to look out for our health. Thank you for your time.
Okay. Thank you. We have time for one more person. Is there anyone else who would like to address the group? Okay. Well, we appreciate your time and thoughtfulness. We appreciate your opinions. And, I mean, everybody has their lives and opinions and different experiences, but we appreciate you coming and being part of this today. If there's nobody else, then we will jump ahead about 2 minutes.
Mr. Chair?
Yes, sir.
If I could just respond briefly to one idea that's been prevalent throughout this discussion today. And I've received several emails and different things about the same issue, and that's about mandating vaccines. I've been involved in local discussions, state discussions, national discussions. I hear nobody implying that that's coming. I hear nobody recommending that or proposing that we're going to require everybody in the country to have a COVID vaccine. I'm not hearing it. I don't know where all this talk is coming from. I don't go to those kind of websites that say it's going to come. It's a secret thing, but I'm not aware of it, and I'm not supportive of it. But I don't hear anybody proposing that. I just want to let you all know that that's not what I'm hearing from any level. So.
Okay. All right. Thank you, Commissioner. Appreciate it.
Sir, we have 2 minutes, and I have 1 minute, please.
You got 1 minute.
Okay.
and
On the 11th of last month, I remember sitting here, it was just myself and this gentleman here, and it was spoken about vaccine sites here.
Yes.
Okay? Well, so it is being brought up, okay?
No, vaccine sites are being brought up.
I'm not saying about mandating, but I'm saying it's being brought up. So that means that there's a thought to put it in.
No, it doesn't.
Absolutely.
No, it does not mean that.
No, there hasn't been any discussion, as far as I know, either, as far as mandating. But if the vaccine is available and people wish to take it, then there has been discussion.
Okay.
I'm sure in all the counties.
I just want to
as
clear
far
that,
as
so people know
trying to put together sites
Right.
that people can come and be vaccinated if they so wish.
Okay. I just want to make sure that we get the right jargon of it too, you know what I mean?
No,
So-
no, there hasn't been any discussions I know of at all about that.
Okay.
Other than, like Commissioner Dale said, maybe on some particular websites or
Sure.
whatever, but as far as discussion politically, in any meetings we've been to, there hasn't been anything like that.
Okay. Well, thank you, I appreciate it.
Thank you.
Commissioner Elliott, may I?
Yes, ma'am.
Just touch on that as well?
Yes, doctor.
I was just going to say, when he mentioned jargon, I think it might be helpful to explain the term points of dispensing,
Yes.
because that's
Okay.
the term that lots of our members of the public will begin to hear about
Okay.
and talk about.
Right.
And that's not mandated, and maybe Nikki, that's what you're going to explain, but that's where people that want it would be able to come to a convenient location.
Okay. Yes, go ahead.
So we're trying to explain that.
Okay, thank you.
Yeah, so I was just going to add, since I'm in a lot of conversations with the local public health districts and state Department of Health and Welfare around vaccination development and the plans for vaccine for COVID-19. And my understanding is that there's 6 vaccines in development. 5 of them are for adults only, and one's being tested, and I don't think it's being manufactured or tested in the United States, but for under the age of 18. I think I can say safely no vaccine's gone through all of its clinical trials yet. So we still don't know that we're going to have a viable vaccine. And there have not been any discussions, and I don't anticipate that there will be any in Idaho around mandating a vaccine for anyone. We do, as Katrina mentioned, we have been asked, and as public health district, we'll make the vaccine available if there's one that is proven to pass through the clinical trials and be approved, make that available to people who want it. And the way that we dispense those is through kind of 2 different pathways. The initial vaccine will not be available potentially for everybody who would want it. So there will be a list of prioritization groups, population groups that would be, say, first in line to receive the vaccine if they want it. And then we administer that either through a public point of dispensing clinic, which basically means we stand up a small clinic specifically for this purpose for a specific period of time. And people of the public who want to come are able to come, typically without an appointment. And we also then have what we call a closed point of dispensing clinic where we work, say, with like a hospital or a jail, somewhere, a long-term care facility potentially, and provide the vaccine to them. And then they, because they have clinical staff available in those facilities, provide the vaccine to individuals who would like to have it. So those are the plans that we're tentatively working on. And like I said, do not include mandating vaccines.
All right, thank you for that. All right, let's see, let's get on to introduction of new employees.
This is Carol Julius, and I do have one new employee to introduce.
Okay.
All right, it's Angie, and I'm going to have her step in my seat here for a minute, and she is a WIC clinical assistant. So, Angie?
Good morning. My name is Angie Montiel. I have worked in public health for 7 years. I've lived here in Idaho for 20 plus years.
Welcome. Okay, welcome to the staff.
Thank you.
Thank you.
All right.
Then you're not here.
We can't hear.
Okay. Is that all the new employees? We had a bunch last month. All right. Okay, then, approval of the August 25th minutes. Have you looked at those? Any additions or corrections to the minutes? If not, I would stand for a motion to approve those.
Mr. Chair, it's Tom Dale. I'll make a motion. We approve the minutes from the last meeting on August 25th.
Okay, I have a motion. Do I have a second?
Commissioner Hannigan, I second.
Okay, I have a motion and a second. All in favor, say aye.
Aye.
Motion carries. Okay, Troy, looks like you're up for the expenditure and revenue report.
Good morning, everyone. I just kind of want to introduce myself. There are folks from the community. My name is Troy Cunningham. I'm the financial manager here at Southwest District Health. And today I'll just be reviewing our financial expenditure and revenue report. So I'll put this in front of me so I don't have to look away. And for those who have that printed in front of you, you can see that from our budget report, you can see that our target should be, we should be about 17% in of the fiscal year. So that's July and August. And then you can see our total revenues up in the right-hand corner that have happened so far this fiscal year. And then our total expenditures with our net cash position. You can see just right of that number is the change in our cash. So that's the change just for August based on our revenues and our expenditures. So the goal here is that number be really close to a net zero process as we move throughout the year. We want to kind of make sure that kind of stays pretty stable. That's actually a little high, particularly for August, and the reason is it just is a little bit more of the carryover from our COVID reimbursements. So reimbursements from the federal grants that we are participating in. So some of that funding was billed in July and kind of started to trickle in through reimbursements both in July and August. And then as time goes on, that should start settling down just as we kind of keep pace with our billing and reimbursements. Moving down a little bit, you can see in our fees lines, we're across the district, we're about 16%. So we're about on target for our fee revenues. That actually is kind of a difference when you look at how each of the different areas performed. You can see that environmental health and clinic are primary sources of revenue in those fee costs. So that has kept us at about 16. You can see I'm sorry, I got to pull this down so I can see in case anyone has any questions. Sorry. You can also see that our contracts are at 34%. Now that's actually twice what we should be. Again, that revolves around primarily our contract reimbursements for our COVID reimbursements that come from federal sub-grants that we receive primarily through DHW, Department of Health and Welfare. And then you can see that we're about 11% in on our interest revenue, and then our other committed funds are about 1%. In the expenditures, our personnel expenditures are just about right on track. We're about 19%. So one of the changes I made from fiscal year 20 in our reporting, in this report from fiscal year 20 to 21, is I actually kind of turned this presentation just a little bit to base that percent on direct costs versus our total budget. The reason is because indirects, our overhead, really kind of don't really give you a real clean picture about our progress. So those percentages off to the far right are based on our direct costs and not associated with our indirects. And I put a little note in a gray box just kind of down below to kind of give you our total budget, then the total indirects, and then our total direct budget. So that just thought I'd clarify that just a little bit to help the reader. And then on our operating, we're a little low in operating. The bulk of what we have been doing in our COVID response is related to our personnel. So most of that really is personnel response. And then our capital outlay is about right on target at 13%. So our total monthly expenditures is about 14.7% of where we're supposed to be at in our direct budget. And then you can kind of see how those panned out across the different areas. So as expected, environmental health is at 22% of their total budget for the year, and that really is particularly again around our COVID response. So, any questions or thoughts so far?
No.
Okay.
That's good.
Okay. So if you want to move to the next page, you can kind of see the graphs. Obviously, there's only 2 data points, so it's not. I didn't put in a trend line because it's really easy to kind of gather the trend in when you just have 2 data points. So Obviously, this is our revenue. You can kind of see again for July, the reason our revenue in July in the contracts area, again, is that COVID billing that we billed for our activity in June, and same thing in August, pardon me. And then you can see our fees have gone down just a little bit from July to August, and then our interest has stayed pretty stable, and we'll see that in a following slide. Then in our expenditures, in that same table, you can kind of see kind of the opposite, where our costs have increased based on our revenues. But overall, as from the first page, you can see we're still in a cash positive environment, which is not ideal, but it should settle itself down as time goes on. And then the third graph is really about our investment trends. And so these are our yields and our percentages. So you can see and it's really correlative. You can see whereas the percent goes down, obviously the yield goes down. I added this last fiscal year to kind of provide you with some, just to kind of see how things go. And as, you know, obviously as the economy moves and as interest rates fall, you can see that that also falls. And that is where any interest that we get on any of the investment funds lives. So that is pretty much the report. Was there any questions or thoughts anyone had there that I could help with?
Commissioners? Okay. Commissioner Marvin? Anything from you? Okay. Sounds like we all understand everything.
Sounds great.
You've done a good job. Thank you very much.
Yes, thank you. I think the only other thing I have is I think I'm next again on the agenda for carryover requests. And I wanted just to follow up on those initially, and you can see from the budget report for August that we had a carryover built in for parents as teachers at $70,027. So when the budget was initially created, that was their estimate, what we anticipated would be left over in the parents as teachers program. Obviously, this was done way back in January and February, so we didn't quite have our hands wrapped around what this would look like by the end of the fiscal year. So particularly, I've got 3 requests that I'd like to present to the board today. So one of them is the parents as teachers carryover requests. So initially, like I said, we had $70,000 built into the budget. In the end, it wound up to be $190,000. So they had $190,760 remaining in those funds that we've received for parents as teachers. And so based on what we already had built into the budget, I need to ask the board's approval to add an additional $120,733 to total that $190,760 that they'll need to carry over for the program. And then the Regional Behavioral Health Board, we just needed to get that one added as well. So that one is $10,792. So those were funds that we had received that they had not gotten completely expended. So we need to add those. And then the Citizens Review Panel is at $7,102. So we received those funds and they didn't get expended by the end of the fiscal year. So we'll need to, I'm asking approval to carry those forward. So those 3 requests in one.
Okay, commissioners, thoughts?
Troy, would you just encapsulate bullet point the 3 requests once again, the numbers?
Okay. Yes, absolutely. Yes, Commissioner. So the parents as teachers is the total that we need to carry over is $190,760. We had already requested $70,027 in the fiscal year 21 budget. So I need to request an additional $120,733 for the Parents as Teachers program.
Okay.
And then on the Behavioral Health Board, their number is $10,792. and the Citizens Review Panel is 7,102.
Thank you.
Okay. Any other questions or comments for Troy?
Mr. Chair, I don't have any other questions. Okay. I would make a motion that we authorize the carryover of the funds that have been specified and put on the record here this morning.
Okay, do you have those on the record then? Or do you need those delineated?
No, I have the 3 programs reflecting the carryover
Okay,
amount.
very good.
That's sufficient.
Commissioner Hannigan, I will second that motion.
Okay, I have a motion and a second for those carryover funds. All in favor say aye.
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 Thank you. Motion carries. Yes, ma'am.
Did we overlook the minutes of approval of minutes? I don't remember.
No, I thought we did, didn't we?
Yeah, we did.
Minutes were, the motion was made by Commissioner Dale. I was in the back of the room and Nick seconded it, but I can check the report.
Commissioner Hannigan.
Thank you. So yes, it was done.
Anything else? Okay. Yes, go ahead.
I have one concerning what we just did.
Commissioner Aberstreet, I need you to speak loud. Sorry to hassle you. Or you can scoot a little closer to the speakerphone.
I will offend somebody.
Okay, well, we can handle it.
Okay. So anyway, we just at our county, we just did an increase to our budget as unexpected funds. We have, according to state law, we have to do that through a public hearing. So I wonder, do we have to do the same thing?
Commissioner Appice, we're not asking, I think we're asking just for carryover funding, not for additional spending authority.
Right. We're not,
And-
no, that's the same thing. What I'm saying is that we had monies that we didn't put in that we ended up getting.
Unanticipated revenue.
Yeah.
This is different.
Okay.
Yeah.
Okay.
Yeah, and my understanding, just based on my time at public health districts, is the only required public hearing is for our annual budget.
Okay.
Yeah, a little different, I think, in our counties.
And Mr. Chair, if there was, I still believe that if there was an amendment to the budget that was to come across, we'd have to have a public hearing for that. But the roll over carryover, that's already been budgeted. It's not necessary for public hearing, my understanding.
Okay. Well, that's something maybe you could check with.
Yeah, I'll check with Mike.
Mike.
Yeah.
And see that we've acted properly.
Mm-hmm.
And if that needs to be corrected, we can do that.
Mm-hmm.
Okay, thank you. All right. Looks like we are ready for Doug and Jamie for the COVID-19 update.
Wow.
Morning. Can you all hear me?
Yes, sir.
All right. Well, I'll go ahead and start with our COVID update. So we're continuing to work on trying to operationalize our COVID response efforts into a day-to-day operation, a day-to-day program here at Southwest District Health. In order to do that, we are hiring a project manager who will oversee the COVID-19 response efforts day-to-day. And we won't be managing the incident as a incident command incident. So once we have that person on board, we will start taking parts of our response effort and putting those into our day-to-day operations within our environmental and community health division. As we do that, we're still responding to the incident itself, and we're continuing to work with all of our community partners, emergency managers, other government or local or state public entities. And we're doing a lot of outreach within our communities, trying to continue to reach those populations that sometimes may be harder to assist. One particular group, our Hispanic population, we're really focusing on providing public service announcements, continuing with media releases, and working with the community members who host different types of events in order to provide that outreach and give them the education that they hopefully can use to better respond to or prevent the spread of COVID within their population. We also are working diligently within our school-based groups now. We actually have a school task force that is made up of several COVID investigators as well as our liaison in order to work directly with the schools and answer questions and provide outreach and education within those organizations. They're meeting with the schools daily and the school districts in order to help them and provide them the information they need to hopefully continue to have in-school sessions rather than online all the time. Our investigations group is caught up at this point. We're maintaining all of our investigations so that we're making outreach efforts to all of the people that come back positive, as well as do the contact tracing day to day. So we're doing a really good job in that effort as well. I do want to cover a few highlights about the past few months regarding COVID response. Our call center still remains very active. As a matter of fact, from July 20th through September 20th, we had almost 1,200 calls to our call center. The majority of the calls that have been received during that time period are inquiring about testing sites or the availability of testing within the health district or locally, travel guidance, business guidance on opening or maintaining good practices within their businesses. Obviously, school guidance was a big one recently. We've had a lot of people calling and inquiring about the schools, and then also the health alert levels that we've posted to our website. Specifically in the outreach realm, we conducted, since our COVID efforts have started, 214 pre-operational food establishment plans that have been reviewed. Those were throughout our district. I'm sure there were plans from each of our counties that we reviewed. We have reviewed plans for 50 special events, and those include rodeos, farmers markets, temporary food vendors, mobile food vendors, etc. And obviously, with the food events or the food establishments operating, we also have had about 30 complaints that we've received at our call center regarding their public's concerns about businesses that have opened or had different types of issues that they felt needed to be reported to us. As far as the liaison group themselves, they've attended almost 400 meetings with our community partners and had approximately 500 hours of staff time devoted just to schools, businesses, 4-H groups, elected officials, chambers of commerce, rodeos, colleges, event centers, and then most recently churches and wedding planners. And this was related to the shutdown in Ada County being kind of all of the events being transferred over to Canyon County or our district for people to be married or that kind of activity. So the school efforts, like I mentioned, they're meeting one-on-one with school boards and providing education to the staff. They're creating and reviewing school plans, coordinating efforts with other health districts to ensure that our messaging is consistent. And then, like I said before, they are overseeing the school investigations and the monitoring of all of the investigations or the positives within the school districts. Social media obviously is a big topic, and we've really, I think, expanded our capacity as well as our outreach in that area just in the past few months. We have almost 120 new social media followers just on our social media platforms. We've had about 81,000 website visits just in the last month or so. We've had 2,200 social media post engagements, and you'd have to talk to Katrina probably to know what those are all about, but that sounds like a lot to me, and a lot of people are involved. We've seen a huge increase in Instagram followers and people that are involved in discussions about things that we are providing or are involved with as well. And then obviously our YouTube channel for all of our Board of Health meetings, we've seen a pretty substantial increase in that area as well. So I believe, one other thing. This is in regards to the firefighters. We've been working with the state health and welfare as well as the National Forest Service to try and provide some outreach to and education to our wildland fire members and the Great Basin team, especially out in the Payette National Forest outside of Council. We have a liaison that's actually specifically dedicated to outreach of the firefighters. Most of you probably know that one of the firefighters was tested last week for COVID. I don't know about the results yet, but they did have a plan in place for that person to be tested, as well as their response to the potential positive case within their firefighter camp. So I think that's about it. I would stand for any questions if anyone has any.
Okay, Commissioners, Doctor? No. Not seeing anybody jump right out there, so thank you very much, Doug.
You bet. Thank you.
Is Jamie going to participate with that also? Or?
I don't think so. I think she punted for Doug.
Okay. All right. Well, thank you very much then, Doug and Jamie both. A few minutes ahead of schedule, but if that's okay, we'll jump into the clinic operations update. So Carol and Clay.
Okay, this is Carol, and I'll start up. I think has Clay joined? I'll go ahead and get started. I have sort of a short list, but several things to update you on. Our back to school immunization clinics were a success. We had 10 school site on-site events and 2 Caldwell clinic late events, 416 children and teens immunized, and 858 vaccines provided. And I am very proud to say our sites included several sites: Caldwell, Notice, Emmett, Fruitland, Weiser, and Payette. So we did reach out to some other areas. And the next update is our electronic medical record, Athena. We are on the downhill side of implementation. We're finishing up data transfer work and training of the staff. We did have a delay of our go live date was in July. We had 3 different dates set and had to change it out, basically due to the data, not to the COVID this time. And so we have a few costs that we were expecting in fiscal year 20 that will be incurred in fiscal year 21 that has to do with the data from the old EMR to the new EMR. Also, another one I wanted to mention is a great success is our new software interpreting tool, and it's called InDemand. The staff really like it, wide variety of languages, including sign. It's very easy to use, and they use trained medical interpreters, and it's less costly than bringing in on-site interpreters or some of our other staff that are interpreting. So that was a great tool to have here in the clinic. Our WIC clients will be coming on site, little kids, babies and moms and dads, families, soon. We don't know how soon. And we'll plan it out a small volume at a time so that we can assure we follow the COVID guidelines as the clients re-enter. And one other note on our back to school immunizations, our staff and the school staff worked together and did a great job on keeping it all COVID safe for participants. It was an interesting process, but we accomplished it. Home visitation, nurse-family partnership, and parents as teachers both continue to be mostly virtual with their clients, unless there's an actual home visit that's warranted, and then they use typically full PPE for those. We're planning to start our project with Marsing School District October 1st, and we're going to provide 1 day a week of nursing services. And we hope that this expands into additional services for the school, healthcare services as we move forward in this. And then Friday last week, our team submitted an oral health funding request, and we're going to partner, if we get funded for it, with a local dentist to provide silver diamine fluoride applications. So it's been listed as one of the greatest health innovations to treat cavities that we've seen. We're going to initially start with children, and we're very hopeful that we get awarded so we can get going in this direction, and it stops the decay process of the cavity. Staffing, we have had 2 resignations. One LPN that has moved to another area, and we are working on a replacement for the LPN to do coordination of our immunizations. And our nurse practitioner that was at 32 hours per week, mostly doing reproductive health, has resigned and moved to another place as of Thursday. So Dr. Roscoe and Nikki and I and our team were looking at our clinic model in terms of some of the changes that will happen. And we do plan to have draft plans for you all to look at in October. And taking a look at 3 areas: school-based services, mobile clinic services, especially in the areas that lack the healthcare resources, and then looking at brick and mortar in terms of our clinic in Caldwell and our outer clinics. And Clay, are you on?
I am.
Okay, you have the last 2 on the list if you want to go ahead with those.
Sure. Okay. Following the last point that Carol touched on with the nurse practitioner resigning, we are meeting actually this week with FMRI Nampa to discuss the concept of a dedicated reproductive health clinic that would be located at the health department, but possibly staffed by FMRI faculty and residents. This is certainly something that FMRI has voiced interest in the past, primarily because it can be quite challenging to get reproductive health clinical experience for physicians in training, especially colposcopy, which we have that capacity at the health department. So we'll definitely report back once we have that preliminary meeting and see where this takes us. The other point is just an update with the health department's ongoing efforts to brainstorm and come up with ideas for increased testing capacity for COVID. We have several meetings this week, basically continuing an ongoing discussion with Northwestern Nazarene University about a potential wastewater analysis demonstration project. They're very interested, as are we. They're doing some pretty interesting novel testing approaches on that campus now with pooled saliva sample testing, but also want to further investigate wastewater analysis. This is already underway at University of Idaho. We've made contact with that investigator who's shared with us their protocol, and we'll also be setting up a meeting between NNU and University of Idaho and ourselves to learn more what's happening in the north. As well, I will be meeting on Wednesday with ESU, who's also interested in learning what the discussions have been in District 3 about around wastewater analysis, and also to get a better idea of what their testing approach has been on their campus. This is all in coordination with the advisory board and their consultant, Brock Anderson, who I've been in contact with fairly continuously. One of the interesting things about wastewater analysis, especially if we can show that it's something that's meaningful in a demonstration project, is that it can be potentially adaptable to other school settings, first and foremost the public school setting. So stay tuned for more information shortly, and that's the end of my update.
Okay, thank you very much. Any questions or comments for Dr. Roscoe? Okay, thank you very much, Dr. Roscoe. We are a ways ahead of schedule.
That's all right, they're
Right here. Oh, man, that's a beautiful thing. All right, well, I know the update is about something not so beautiful, but Septic Program update.
Our chairs are arriving.
Okay, well, good.
I don't know, I think septic tanks are a beautiful thing.
Well, it's definitely necessary.
And they work.
Definitely necessary. But if you've ever had to install lift pumps in them, they're not that great.
It's already working.
Yeah. Been there, done that.
We have the project right here. Oh, great. Okay. Well, good morning. This is Jamie Annenson. I'm a division administrator here, and I have brought Olivia Howard. She's an office services supervisor with me. We recently hired Mitch Keister as the lands program manager in environmental health, but he had the good fortune of going to jury duty this week, so.
Not jury duty?
Yeah.
Wow, that's
Yeah.
odd.
We don't have any jury
Yeah.
in the outcome.
Federal. Yeah.
Okay.
Oh, okay.
So here we are, standing in for him. Wanted to give you an update on the septic program. We've had a couple of conversations with you in the last few meetings, and just to tell you some of the things we're doing to really try to catch up on the work. So our permitting process, we have been catching up from COVID. So with all of the response, we had to redirect staff, and we've been extremely busy, as I'm sure you're all aware, with the permits coming in. So currently, we are about 1 day behind. So we have made some huge strides in getting caught up. Our applications are now being processed within about a week. So I think that's great improvement from when we spoke, and it was taking quite a bit longer, as you've all heard from your constituents. So we are in the process of replacing staff. So we've had some people leave, we've had retirements, we have upcoming retirements, So, we are working on that right now and have a plan for training.
Can you speak up just a little, please?
Yeah. So we have a plan for training, of the new staff, and we're actually, working on a soils evaluation class. So we have at least three staff, possibly 4 that are gonna be going to in October, so that'll be a great opportunity. We have been working to identify what our training needs for staff. Okay. And so this is Jamie again, and we are also working on identifying that institutional knowledge as people retire. We have some people who have been here a long time doing this work. How do we harness that institutional knowledge and pass it on to our newer staff? So those are some of the things that we have been working on. Olivia, if you have any other specific updates on, so the front office really is very busy, getting a lot of permits in, and it's quite a process to get things entered into our system in a timely manner. So we've been really focused on that and making those improvements.
So this is Olivia, and I just wanted to provide kind of a more broad update. So since September 11th, we've processed over 50 applications. That's complete process and taking them to an inspector. So now it's, with the inspector, so they're in the final leg of the process, which I'm very excited about. Our staff has done a great turnaround in a short amount of time, and I'm really happy with the progress. Another thing I wanted to bring to your guys' attention is I have some blank applications here if you guys would like to look at them, but a lot of the backlog that gets created is not so much an error on our side, but as an error of our customers not knowing how to properly fill out an application. There is a lot of data on here that if you don't know what it means, you won't know where to find it. Yes, they can absolutely stop by our office and we'll tell them where to find it. They can call into our office and we'll walk them through it. But we legally can't put down any of the information. So if it comes into us without it, we have to give it back. And that's kind of what creates that backlog, specifically finding your parcel number and your legal description. The township range and section and parcel number can be found on tax documents, the assessor site, but that's something that the customer has to get themselves. So that's the thing we've been struggling with, is to have customers grasp that idea and know where to find it. So we're creating a how-to video. I'm actually going to be filling out both of our applications that we provide while being recorded, and we will post it to various places so that it will walk customers through how to fill out the application, and hopefully we can start getting completed applications on the first try. So those are our...
I have a question on that.
Yes.
Who is filling out these applications? Are they the contractors who are installing systems? Are they private homeowners that are doing it themselves? It seems like if it's a contractors, they ought to know this process.
So this is Olivia.
Has it changed, the format and the forms?
The format and the forms have not changed. What we're finding as the contractors that fill it out for us, they're becoming comfortable, and they are thinking, because they've put so many in, that it's a fast process and they can leave some stuff out, and we're not going to send it back to them, kind of creating, that, oh, they know me, I'm a frequent flyer, I'm just going to turn it in. Then we have the homeowners who don't have the high-end systems who will install it themselves, and they will come in and fill it out. And if you've never looked at your tax documents, you don't know what you're looking for. So it's a vast variety of who we see filling out these forms.
Thank you.
So township and range then is necessary, not just an address, even if the county has already addressed that area?
Yes.
Or that parcel?
Yes, so a parcel number, a property address, if the address has not been determined, it's just a to be determined, and the street your driveway is on. The township range and section and the county are absolute must, or it goes right back out the door with you.
Okay.
So this is Jamie again, and in addition to doing the video, we're also working on making this application in a fillable PDF. So again, we're really trying to figure out ways to streamline the process and make it easier for our customers to complete the document. So we'll have the fillable PDF version that will hopefully decrease the number of incomplete applications that we're getting, and then the how-to video that customers can watch and the step-by-step process for filling out the application.
Asterisk with must fill in.
Yes.
And it can't send until it is.
That's the goal of the PDF. This is
Yeah.
Jamie again.
I'd need something like that.
Yeah, this is Jamie. The goal is that the PDF document will not advance until you complete the field.
Yeah, that's a good thing. Good, good. That sounds good, because, yes, we have heard from our constituents, I think all of us. Not just one.
Yeah. So we're actively, this is Jamie again, we're actively working on that, understanding that you're hearing quite a lot of feedback, and we are as well.
Good. I'm glad you have a good plan. Sounds good.
Okay. Do you have anything else? That's all we
Anything
have?
else? That's it?
That's all?
You don't have anything else new, exciting for septic systems?
No, not today.
All right, well, appreciate it.
Okay, thank you.
Appreciate you working on it and taking this serious. It is serious to those folks that got all that money hanging out there, waiting to build and can't get a building permit or whatever. So it is very serious. Thank you very much. We, again, are ahead of schedule. This is unnormal. It's abnormal, or whatever the right word is. Abnormal? I think that was young Frankenstein. Yeah. Anyway, we are ahead of schedule, but we are scheduled for a break. So we will go ahead and do that. We'll take about a 15-minute break. If you have old knees, you need to stretch them 2 times.
Speaking of vaccines, I got a flu shot and a pneumonia shot yesterday.
Oh, boy, yeah. Are
My
you
arm's
stiff?
killing me.
Yeah.
There are a few bottles of water on that back table and a few to the rest snacks. Get more members or guests. Yeah.
Alrighty, so just a reminder to everybody who's on the Zoom call and watching through YouTube, we will be back in about 15 minutes after the break.
Okay. I think that works.
Yes, we can hear you. Thank you.
Thank you, Ashley. Thank you, Ashley.
Okay. I guess the question would be if Sarah is available a few minutes early.
I did communicate with Sarah, and she is ready to go.
Okay? In that case, then, we're still about 10 minutes ahead of schedule, but let's get started again. We all have things to do. We finish 10 minutes early, that's just, we can do 10 minutes more work. All right. So, if Sarah is available, we will get started with the Western Idaho Community Crisis Center update.
I am certainly available. Thank you. I am going to actually share my screen with you. Alrighty, so are we looking at this one, the Western Idaho Community Crisis Center presentation?
Yes.
Fantastic. Well, so far it's all going according to plan, so that's great. So my name is Sarah Andrade. I am the Behavioral Health Director for Lifeways. And one of the things that I oversee related to behavioral health in Idaho is the Western Idaho Community Crisis Center, which is something we do in partnership with Southwest District Health as well as several other local organizations to provide emergent crisis services for behavioral health and substance use to individuals residing in Region 3, which well, you're aware, Adams, Canyon, Gem, Payette, Owyhee, and Washington counties. So the basic services that we have available for those who are unfamiliar, I did notice we had some community participation, so I'm going to run down them really quick. We do basic medical screening for safety and stability. We provide mental health assessments, mental health crisis assessments. We offer immediate access to mental health and/or substance use stability supports without an appointment. We are able to offer telehealth. We actually began rolling that out prior to COVID, and then we're certainly glad that we did once COVID was in full swing, and we've continued to offer that service. One of the things that is sort of different about telehealth that I'll just sort of give a brief explanation for those who are unfamiliar with how telehealth works related to the crisis center is our links are able to be utilized on any smart device. So an individual would be able to call the crisis center, identify that they would like to have a face-to-face consultation with a provider, but perhaps they're maybe unable to get there or uncertain about wanting to get there. We would send them a link to any email that they identified. It's a one-time link, so it only works one time. They click into the link, and on any smart device, so a tablet, a smartphone, they would be able to speak face-to-face with a clinician. At times we've had requests to speak face-to-face with the EMT that's on site or a peer support that they may have connected with during a previous visit. So we've been able to not only offer a first-time contact with the crisis center, but also sometimes extend opportunities for stability by leveraging telehealth as a resource. We're able to do brief and crisis interventions, which are facilitated by licensed mental health clinicians. We're able to offer clinical support and assistance for individuals and also loved ones who are managing a crisis for someone who's having a rough time. We have peer support specialists on staff. We have recovery coaching on staff. We're able to offer assistance in advocacy and offering community providers or accessing community providers to partner in symptom management, stability, and recovery. And then one of the other things that we're able to do as a partner with the Idaho Food Bank is we are able to be a closed door food pantry, which means that individuals who are accessing the crisis center would also be able to leave with a food box if they screened positive for food insecurity. So some of the changes that have taken place, because many of you have heard the song and dance of what the Western Idaho Crisis Center does, some of the changes that we've seen COVID is we've had to change some of our protocols to accommodate for the concerns that come along with contagions and specific COVID concerns. So we have implemented a masking requirement, and that goes for staff as well as for participants accessing the crisis center. We have had to reduce to some degree our census capacity to allow for social distancing to take place, which means that we have spread out the bunks. Initially, it was 10 and 10, 10 male, 10 female. What we have done is removed 5 of the bunks. Really and truly, we've removed 3 of the bunks. We put 2 in the quiet rooms that were available before to allow for an additional resting area. And then we have spread the other ones out to allow for social distancing. When individuals are lying down in their bunk or sitting on their resting mat, they are not required to wear a mask. And they are not required to wear a mask when they are outside of the facility, but still checked in, provided that they are making sure to social distance. So we've had just a couple of modifications that we've had to make to keep everyone safe. We've also seen an uptick in homelessness or individuals accessing the crisis center to address homelessness. One of the things that has happened is some of our shelters in the area have closed down, or they have implemented their own protocols that has made it very difficult for individuals to access the same center with the frequency that might be required sometimes to become stable. And so with that, we have seen kind of an uptick in individuals that are coming to the crisis center and identifying as homeless. We've also seen a greater degree of food insecurity, job loss, job insecurity, increased substance use disorder qualifiers coming in when we're doing that initial screening. Another thing that has contributed to this is that the resources that were historically available to address substance use disorders are somewhat more limited, in that an individual who perhaps is doing a medical detox will get the medications and perhaps once upon a time would have gone to a facility where they were able to manage that. Now they're coming to the crisis center because those facilities are not accepting individuals who haven't met the screening protocols. We've seen some amplified domestic stress. Some of the resources that are available for domestic violence, well, what I can tell you is that they are being highly utilized. And so sometimes we're just kind of addressing that volume need until that resource is open and that community agency is able to take that individual on. Or there are specifiers that would restrict the individuals that are accessing the crisis center. An additional thing that I thought was interesting as I was looking at the data, and then also as I left the crisis center this morning, is that we have seen a huge surge in individuals that are accessing the resources that are available through the crisis center, even if it's just to refer out to another facility that might be more appropriate. But phone services, specifically interventions that are delivered to individuals who have either tested positive and are just having kind of an overwhelming anxious response to that they need to have addressed by a clinician, or that they're interested in accessing community resources. Typically, we refer directly to Southwest District Health, but what we're able to do in the meantime is offer some opportunities to access outpatient services via telehealth so that they're still able to continue treatment while they are managing symptoms associated with COVID. My slides are not advancing on your side.
Hi, Sarah. No, they haven't.
Well, that's upsetting.
Sorry. I just texted her. I wasn't sure.
Yeah, I should see that. I wonder if I'm sharing the wrong screen.
Well, we can see the slides, but it almost looks like it's in a different setting, maybe, in PowerPoint. And I don't know if maybe Ashley knows, but Or maybe, do you have a split screen? Because what we're seeing, it looks like, is,
Slide 1 of 11.
yeah, it's slide 1 of 11, but it looks like it's, one side of a two-sided.
Hold on a moment. I'm going to see if I can try again. I do want to tell you that these slides are killer, and I'm really upset that you missed several.
Obviously.
There we go. Think. It looks different.
All right. So COVID intensifies, changes, needs, and WITIC services. You're seeing that one, right?
Yep.
Yes. Fantastic. Appreciate your patience. Okay. So the other thing that has been really interesting is that a lot of those phone services that we're delivering are actually are from individuals, professionals in the community that have been exposed or are incredibly concerned about their risk tolerance. And what that is going to mean for them. And so what we've been able to do is, yes, leverage the Crisis Center as a resource, but also provide some sort of basic education around their EAP. A great example is local educators. So there is some anxiety that exists there, and I'm talking region-wide. There is some anxiety that exists there. We've had a number of educators reach out to find out more about their EAP, and they're welcome to do that through the Crisis Center. Really what we're looking to do is offer the most cost-effective and immediate opportunity to maintain behavioral health and well-being, and also leverage this resource as something kind and loving that this group, but really all of Region 3 has come together to provide for them. So we've been able to offer some of those regardless of whether or not they have been exposed or have tested positive. One of the things that is also important to remember is we are not a medical facility. So an individual who comes in has to meet some kind of basic health guidelines that would allow them that the Crisis Center would be appropriate to meet. So we can deliver medications that are already prescribed. We are not set up to manage anyone who is COVID positive or who has been exposed. It's just too great of a risk in that facility with an open floor plan and the proximity of the individuals that are in there. Question?
Have any of your personnel been tested positive for COVID?
Have any of our staff tested positive for COVID?
Yes.
So out of the Crisis Center, we have had 2 exposures, no positive tests. And I'm trying to think, out of those, the other thing to remember is that we're doing screening for each staff member, every site that they attend before accessing the site. And it's a full screening. And they're all donned in PPE that is appropriate for that setting.
Okay.
Is that helpful?
Yeah, I just wanted to make sure that, just looking to see if there was any positive from the personnel that are working there, staff.
I am almost, so I'm knocking on wood right now. No, not yet. And I'm really hopeful that we'll be able to maintain that, because as you'll see when I go through the numbers, we are running at full census all day, all night, pretty consistently. And so we have had a couple of needs to jockey in staff from other location and do a lot of cross training, honestly, in anticipation of exactly that.
Okay. Okay, thank you. Appreciate that.
Absolutely. So the partnerships that we have right now are Southwest District Health, Lifeways, Canyon Recovery Community Center, Victory EMS, the Idaho Food Bank, the local police department is amazing. Probation and parole has been great as well. local hospitals and emergency departments, inpatient hospitals, Intermountain Lifeways Hospital in West Valley. It's not that they're not a partner, we just haven't seen any referrals from Cottonwood Creek. And also they have pathways over in Boise. And then Region 3 Mental Health, as well as we have an amazing advisory board. They are so incredibly supportive. Going through COVID, we have seen a number of our resources that we always had in abundance prior to this sort of dry up a little bit. And they have been just great about hearing those from the reports and then jumping right into to provide resources like access to clothing for the individuals who come in the center and need it, or additional opportunities to provide food or games or things that folks at the crisis center might appreciate, hygiene kits. So changes, we are offering additional, more robust case management services. In fact, in re-examining our staffing model, I went ahead and added an additional FTE of case management throughout the Monday through Friday, 9 to 5. So individuals are able to access that when they do a full admit. I think it's important to remember that a full admit does not mean you have to stay the entire 23 hours and 59 minutes. In fact, right now we are doing a number of high volume turnovers, which is great because it means less people actually in the environment at the same time, but still getting the resources they need and knowing that they can come back at any time to access them. So we're offering more capacity for peer support services. I've hired an additional clinician and taken on 2 additional master's level interns out of NNU to offer some additional skills training groups, as well as assist in enrolling in local programs. So filling out the paperwork associated with accessing unemployment or food stamps or getting on Medicaid. Whatever the need may be. We find a lot of individuals, this is their first time looking at something like a food stamp application, and this is just a different time. And so it has required a lot of assistance and a place to do that, where you can kind of move through those stages of change and acceptance that happen when you're looking at your life in a new way, your circumstances in a new way, and sort of what opportunities exist now. We've also added supervisory capacity to allow for more robust internship force. We're adding a foundational skills group that will take place throughout the week. And then transportation from the center is becoming a bigger issue than transportation to the center. And so what we've been able to do is, one, make sure that we're offering those follow-up phone calls and folks understanding that they can access telehealth. But then additionally, we have jockeyed the way that we're providing vouchers. If you remember, we applied for and were granted a grant for transportation services. I don't want to say the problem with Region 3, but an opportunity for growth in Region 3 is some public transportation access. So right now, what we've been able to do is leverage services like Uber Health, Lyft, looking at any of those programs that would be able to take a voucher or that we could provide a voucher. We also have been able to give gas cards to family members or members of a support system that have agreed to come out and pick up an individual. We understand that resources are tight, and so we want to make sure that when appropriate, we're able to provide that resource to folks. It's a limited resource, so I want to be clear that we're being really frugal and really kind of screening out any potential opportunities that exist, because once that is gone, it's gone. So this is kind of our overall performance after the last several months. So in June, the team provided 123 services throughout the course of the month with an average of 4.1 per day. One of the things for the crisis center to know is that we are working toward a sustainability model. I would argue that we were one of the first crisis centers, or if not the first crisis center in the state of Idaho, to kind of have a planked out game plan for sustainability from inception. And so what our game plan was involved securing contracts with private pay insurances, as well as managed care systems like Optum, but then additionally giving opportunities for communities to contribute to the health and well-being and sort of proactive measures that would be less expensive in the long run in meeting the mental health and substance use needs in their community. And so with that sustainability model, where we hit a break-even point, where we're full sustainable, is at an average of 9 intakes per day. So in July, we went from 123 to 280, which was an average of 9.03. Out of those, 78 were Optum. I'll go through the payers that were paneled with later, as well as what we've been able to collect. Again, not what we billed out, but what we've been able to collect. So 78 of those were through Optum, which is Idaho Medicaid, and then 16 through United Healthcare. In August, we went from 280 to August, we did 448 intakes, an average of 14.45 per day, which is 63% higher than in July. We did 101 of those individuals were covered by Optum, which doesn't mean that we only billed Optum 101 times. It means that for each individual out of that 448 that was covered by Optum, 101 of them were covered by Optum. However, we are finding that individuals are accessing the crisis center with a higher frequency than they have in the past. And part of that is what we've seen is due to that population that I mentioned earlier related to substance use disorders. So to avoid a relapse or to avoid a triggering situation, or perhaps managing a relapse and hoping that it is more of a temporary relapse than long-lasting with longer-lasting consequences, they've been encouraged to come back and utilize the crisis center as one of the planks on their safety plan. And then 16 from United Healthcare. So this is us so far September. I pulled this data this morning. So we have completed 320 intakes as of 6 o'clock this morning. So we are tracking well into September. I say tracking well. It's a lot of work. It's a lot of support. It is a constant quick pace that they are maintaining down there. However, what sort of gives me hope about this is that folks know it is there and that folks are accessing this in lieu of either more costly, less appropriate levels of care, or they are accessing this to maintain their own safety or provide for the safety of a family member. So we're averaging about 14.55 per day, which is already higher than what we were seeing in July. So payers and payments, so far we have received $108,190. What I will tell you is that those are all payments that have come from Optum. Folks have different feelings about Medicaid. What I will tell you is that they're incredibly efficient in identifying inefficiency in your systems, but also in their own. And so typically when we bill out, theirs are the first that we see reimbursed. One of the things to be mindful of is that we bill we collect insurance information for every individual, including the fact that they have no insurance. And then we bill out a flat rate to that insurance company. There are no copays, there are no charges to the individual. So there is essentially no financial consequence to an individual or a family system deciding to utilize the crisis center to manage the behavioral health needs or the substance use needs of their family members. And that is something I think that is revolutionary for Idaho and really cool to have in our community, because historically you've seen very specific populations access services that were designed to treat an imminent need, which meant that a large portion, typically our blue collar workforce, went without care because the cost of that was not something that their family system could shoulder, or that if they did, it was to detriment to that whole system, and often that individual's recovery, because that's something then they carry with them. So other payers that we have paneled with are St. Luke's Health Partners, Blue Cross, and United Healthcare. I believe that we currently are going through the paneling process for IPN. We have submitted everything on our part. It's sort of a waiting game on that, on the other side of that. And I believe that is, oh no, I have more. Representation by county, again, I pulled this morning. So this is the data that is available for us for September. So out of Canyon County, we're seeing 207 individuals. Gem, we saw 9, Payette, 25, Owyhee, 6. I didn't put it on here, but I believe Washington County, we saw a little bit of an uptick there, and that typically we'll have 1 or 2 over a 2-month period, 2 or 3 month period. I want to say, as I'm looking, we had 7. Ada County, we had 20 individuals come out to Canyon County to access our crisis center. Region 4 does have a crisis center. Some of the feedback that we've received from individuals who are coming from Ada County has been that we've seen some detoxing that needs met there, and the feedback that we've received has indicated that it's a little bit more discreet to do that in our community as opposed to theirs. We do collect insurance information from those individuals as well. And then from Butte, we saw 1. Cascia, we saw 1. Twin Falls, we saw 1. Out of state, we've seen 2 from Oregon and 1 from Colorado. And then we have seen a number of individuals who didn't identify their county of origin. So I am going back and cross-referencing with the address that they provided. We've also had a couple of law enforcement pickups or state patrol pickups. And so it's been a matter of identifying those individuals who came in identified as homeless. And so we are looking, I think 3 of them we've maintained over the past 2 days and are looking to get some more identifiable information. Sometimes that's difficult due to sort of the state that an individual presents in, kind of where they're oriented, if they're good or poor historians, sort of depends on the symptomology. But we're patient and we're resourceful, so we are definitely reaching out to every resource imaginable to assist us with that and make sure that we're able to get those individuals to a level of care that's appropriate, but also to a community that may be missing them. And that is all I have for you.
Good report. Very good. Questions, comments, commissioners?
Well, all the questions I had, you answered.
Well, good.
Thank you.
I appreciate the report and to show that this is running at capacity for the last 3 months.
Yeah.
That shows that it was a really good thing to get started up, and the need is ever present, and it's gratifying to see it used as it is.
Yeah, especially during this time, she said a big uptick.
Yeah.
You know, from, well, probably lots of things related to COVID pressures that's on people.
Yeah.
We're seeing in our neighborhood, in Homeville, Arsenal, we're seeing a big increase in food needs.
Yeah.
Elliott,
I've seen that also.
Is there, you know, one of the Whitecaps, and they're basically overwhelmed.
Yeah. No, I've heard that also from our Whitecap in Gem County. Okay, well, very good. Thank you very much for that report, Sarah. Much appreciated.
Absolutely, my pleasure. Thank you for having me.
Okay, thank you. All right, so now on to you, Dr. Zog. We're gonna go back to Nikki.
Let's just stick with Nikki.
Okay, we'll stay with Nikki. The COVID-19 health alert level update.
Thank you, Mr. Chairman.
Thank you.
Nikki, will you make
Oh,
that
you're
go
welcome.
away again?
Oh, yeah, it keeps popping up here.
I don't know why.
And then the cursor's in the middle.
And
Put
I've
that
been in
across my
communication with
face.
Rachel and she,
There we go.
Oh.
thank you.
Okay, so I believe Rachel is joining us as well, and just as a reminder, that the board had requested that we review and have the board approve our health alert level process and metrics. We haven't changed any of our metrics, but I thought we would just go ahead and have Rachel provide an update on where we are with our health alert levels currently and where we're trending. So I'll turn it over to Rachel. Hopefully she's on.
Hello, can you hear me all right?
Yes.
Okay, awesome. I just have a really quick update today on the health alert levels. We actually did have one sort of metric change, which I'll discuss here in a moment. So currently we have Adams County is in the gray category, Owyhee and Gem County are in the yellow category, Washington and Canyon County are in the orange category, and then Payette is in our red category. And then we are also updating these tomorrow on the 23rd. But overall, we're just seeing a decrease in incidence rate across all counties, which is really good to see. We are seeing more community spread than we'd like to see. We still have some work to do on that front. Our investigators are making contact much sooner. I think that's just directly related to how many cases we're investigating. As those numbers are going down, they're able to respond a little bit quicker. And so the one metric that we did have a little bit of a change is our positivity rate. We actually have that data available by county now. And so this is the second week that we've had that available. Prior to that, we were just using our district-wide positivity rate, and now we can actually kind of specifically drill that down to the county, and that's kind of making that metric just a little bit more relevant to us. And that's really all I have, just a quick update. You know, things are looking good, but we just need to keep focusing on what we're doing and keep trying, and yeah. All for me.
Anything else, Nikki?
Mr. Chairman, no, I have nothing else to add, other than.
Can I ask a question? This
Yes.
is Dr. Summers. Is the positivity rate of testing directly correlated to the levels that the counties are in? So is Payette much higher than Adams versus Washington, et cetera?
So the positivity rate is definitely one of the major metrics that we're looking at, alongside our incidence rate, community spread, and then feedback from our investigators, you know, seeing what sort of cluster outbreaks we're having. So a great example of this is Gem County. Last week, we were seeing actually an increase in incidence rate, but the overwhelming majority of that was due to a isolated cluster outbreak in a congregate care facility. And so we are using that qualitative data to kind of understand what that positivity rate and incidence rate means for the community.
Okay.
Have we seen any upticks in any of the school districts that have opened up?
We have been seeing some cases here and there. That's definitely something we'll be reporting on the health alert levels as well. We have a section for educators input, which is really where we talk with our school liaison and see, you know, what kind of risk is associated with the different schools in that county, the different districts. But we've seen a little bit so far.
Any other questions or comments? Okay, well, thank you very much for that report.
Thank you.
Rachel. All right.
Mr. Chairman?
Yes.
This is an action item because that was the request of the board to
What are we acting upon?
to continue, I guess, using the health alert level system that we have in place with the measures and mitigation strategies moving forward.
Yeah, Mr. Chair, you know, I think it's good to keep this up. The other thing I would like to just maybe comment is that, and Nikki, correct me if I'm wrong in my understanding of this, but our metrics and our levels are different than what Ada County is using. They're using just a 3 system, red, yellow, green.
Yes, I believe that is accurate. I think the rest of the health districts in the state are using a 4 level, and our measures are fairly similar. And our measures are pretty similar to Ada County or District 4's as well. They're looking at fewer measures than what we decided to look at, and I don't know if they're including qualitative data, which, as Rachel just described, can be really beneficial, particularly in our rural communities. So there are some differences, but I think overall, if you were to apply any one of the set of measures that a district has adopted, you'd probably get close to the same conclusion.
So, and I guess I just mentioned that to let people know that if you're trying to make a direct comparison to Ada County or Central being in a yellow area, it's not directly comparable to Southwest District's metric.
Correct.
A little different.
Yes, because we have yellow also, but our yellow is a little bit harder to get to.
Right.
Because our yellow, yeah.
And I'll just also make a general comment too, that I've heard from several people who access this information on a regular basis, and they are very complimentary of the dashboard and the metric and the whole system of information that is coming out from your staff here at the district. And so that's just a comment to say, job well done, let's keep it up, let's keep moving forward.
Yeah, I appreciate that feedback. It's something that we've worked really hard to do, and I would have liked to obviously have it done sooner, but yeah. I like where we're at right now. And if there's any input that you have from the public, or you have interest in data that we're not sharing right now, although I feel like we're sharing about as much as we have, but
as much as you can.
Yes, that too. Thank you, Commissioner Handigan, for that comment. Yeah, so, but if there is something that you feel like, hey, can you look at this, or even a few maybe 2 meetings ago, I might have mentioned the length of hospitalizations and severity of illness seemed to be a little unusual from what had been happening. And not only did we notice it here at the district, but also some of the hospitals, Idaho Hospital Association and Department of Health and Welfare also has some of the same concerns. So we're looking into that. So if there's questions that you have, even just generally maybe about something that seems different, we're happy to explore and try to answer those questions as well.
Good.
Okay. In that case, is there any other discussion on that? If not, I would stand for a motion.
I'd move to adjourn.
No. Not yet. I won't take that one from me.
Oh, God, I was gonna come back with a quick second.
All right, come on. So what do we?
Okay, we'll continue with the level updates the way that they are.
I think Georgia
the way they
has
exist, basically.
I would move that we continue with the current health alert level metrics and updates.
Okay. Now I have a motion. I have a second.
Second.
Okay, I have a motion and a second. All in favor? Aye. 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 Okay, motion does carry.
Just get paid on.
Now, we still have.
I need your help.
Now we still have one more item.
Oh, okay.
Which is the director's report.
Oh, okay.
I will be pleased to announce that I have nothing to add.
Okay, now I would stand for motion to adjourn.
So moved.
Take a motion to adjourn.
Okay. All in favor, say aye.
All right.
Aye.
Good enough.
Yeah.
Okay, we are adjourned.
Am I reading this? That's
Wonderful. Thank you, everybody, for joining us remotely today.